Greetings, Miss Stacy and fellow students. Today I'm going to talk to you about bone density. I will give you some interesting facts about bone density and why it's important to love your bones, and also how we can prevent ourselves from osteoporosis. And I'm so sorry, I didn't introduce myself. My name is Jasmine Wright, and I am a student, and I just learned a little information about bone density. So, the overall risk of osteoporosis is influenced by age, gender, and ethnicity. The older you get, the greater your risk of osteoporosis. Women are more likely to lose bone than men due to rapid bone loss, and at menopause, osteoporosis is also more common in people of the white, Caucasian, and Asian race, possibly due to differences in bone structure and peak bone mass. What causes bone density? Not eating the right things, not eating enough calcium foods, such as yogurt, milk, cheese, beans, almonds, etc. Your family history also plays a big part of it. Poor nutrition, malnutrition, vitamin D deficiency, thin or petite built as well, frequent falls, certain habits such as drinking alcohol, drinking too much of it, smoking can cause weaker bones. And the symptoms of bone density, there are typically no symptoms at the early age of osteoporosis. That's why they call this disease the silent killer. However, you may have signs and symptoms that include back pain, loss of height over time, a stooped posture, a bone fracture that occurs much more easily. And some of the treatments recommendations are often based on an estimate of your risk of breaking a bone in the next 10 years. For both genders, the most prescribed medications are alendronate, risendronate, ivendronate, and zoldronic. There are so many side effects with this medication. It can cause pain and discomfort, allergic reactions, nausea, vomiting, rash, and also swelling. So there are also some effectiveness of preventing this, and depending on your clinical assessment, your doctor may have some specific recommendations for you, such as calcium and vitamin D supplements. Of course, exercise always helps. The patients that are more at high risk will need drug therapy to protect themselves against fractures. In today's world, there's such a wide variety of treatments, so you just gotta pretty much pick what's best for you and whatever your doctor thinks that's best for you. Okay, and also you can get a bone density scan. The scan is a procedure that requires no injections or special preparations of this procedure, very minimum radiation exposure. The cost of the bone density scan is usually covered by your insurance, and no referral is required. This exam gives patients the info needed to be for a proactive approach in maintaining bone health. In conclusion, love your bones, please, people. Keep this condition in your control. Please regulate a regular exercise lifestyle, a bone healthy diet, which is very important. That's something that we should be doing regularly, just doing as a lifestyle. And also, always consult with your doctor about osteoporosis risk. Be very proactive. Find out whether you're at risk and get tested. And also, here's a few models that I printed up from the internet. And this one model was Stop Osteoporosis. And if you look at the model here, it shows that the model has a very straight posture, and that shows healthy, strong bones. And then the second model has a stoop posture, and that's caused of brittle bones. And then this one is normal bones, and this one is fractured bones, and which eventually will lead to a broken bone. And this is just another model, and it's osteoporosis is a disease where increased bone weakens, increase the risk of a broken bone. And I also did read about a fact, and while having osteoporosis, if you sneeze, you can pretty much break a bone, and I thought that was very interesting. Thank you for taking your time out to listening to me. Until next time, thank you.